Fires, no matter how small or where they occur, have the potential to cause serious injury or death, not to mention damage to property and interruption to activities and services. In healthcare facilities, the impact of a fire may be much greater, since patients may have restricted mobility or be dependent on medication or specialist equipment for their ongoing care. Smaller healthcare properties without highly dependent patients may be able to fully evacuate patients, staff and visitors to a place of safety outside of the building. This may be an assembly area or an alternative location where medical care can be continued. But dealing with a large healthcare facility, complete with patients, staff and visitors, presents complex challenges. The evacuation of an entire hospital due to fire is an extremely difficult exercise that may well disrupt patients' ongoing care or even put lives at risk. To ensure minimum disruption to patient care while protecting them from any fire or smoke threat, complex healthcare premises are divided into a number of fire-resistant areas called fire compartments. Compartmentation restricts the spread of fire and smoke within a building or between adjoining buildings for a predetermined time. Fire-resisting walls, floors, doors and glazing are used to separate compartments. Containing the fire aids safe evacuation and protects occupants, property and contents from fire and smoke damage. Smoke and toxic fumes cause more injuries than the flames from the fire, and the thick black smoke that often accompanies fires in buildings can quickly disorientate and incapacitate people trying to escape. Larger healthcare properties will usually implement a progressive horizontal evacuation procedure in which people are moved away from areas of danger into adjoining fire compartments unaffected by the fire. This strategy involves people being moved to a place of relative safety away from the fire, simply by taking them through sets of fire doors, initially on the same floor level. Generally, the compartment in which the fire is situated will sound a continuous fire alarm, while neighbouring compartments will hear an intermittent alarm. For this type of evacuation to be effective, however, early fire detection and confirmation is vital. Early detection of a fire provides the maximum time for an orderly evacuation of those at risk. It also assists in ensuring the fire is tackled at an earlier stage, since help is summoned promptly. Depending on the building's construction, age and layout, fire detection will be due to staff observation or automatic smoke and heat detectors. So what do you do if you smell burning, you see smoke, or you hear a continuous or intermittent fire alarm? If you smell burning or see smoke, you should always raise the alarm. Even if you cannot see the fire or find the cause of the smoke, you must always trigger a fire alarm call point. Operating an alarm if you think there is a fire will never get you into trouble, even if it proves to be a false alarm. The procedure, whenever you suspect or discover a fire, is sound the fire alarm. This will also set in motion the procedures to call the fire service and lets everyone know there is a problem. Dial the internal emergency number and pass on relevant information to the switchboard, call centre or fire service as soon as possible. Commence evacuation, closing all doors and windows as you go if it is safe to do so. Remember, never use lifts unless you have been told they form part of your evacuation strategy and it is safe to do so. Once the alarm has been raised either by an alarm call point, a detector, or by using an emergency phone, the next step would normally be to try to confirm the location of the fire, if this can be done safely. A designated member of staff would normally do this, while other staff prepare to evacuate the area. If doors have viewing panels, check for signs of fire. Do not open doors if you see smoke around them, or if the door or its handles feel hot to the back of your hand. Staff in areas where intermittent alarms are sounding should check the nearest alarm panel to identify the fire location. If the fire is in an adjacent area, staff will usually need to assist the evacuation. Prepare for incoming evacuated patients and get ready to evacuate to the next safe compartment if it becomes necessary. When leaving a fire compartment, all fire doors must be closed to ensure the fire and smoke is contained for as long as possible. Closing windows and other doors will also help prevent the fire spreading and potentially slow its growth. Clinical staff may need to determine what are acceptable risks before deciding to move patients or reposition equipment. This will particularly apply to intensive care units, patients who are undergoing surgery or are dependent on equipment to support them, and mental health units. During any fire alarm in a large healthcare building, non-clinical staff, unless they are aiding patient or visitor evacuation, should always move into a safe area. This may be an area with an intermittent alarm on the same horizontal level or on lower levels of the building. In smaller healthcare premises, alarms may be raised by staff or by automatic detection. The evacuation signal might be bells, sirens, word of mouth, or even specific music tracks, depending upon the type of care undertaken. Whenever you suspect a fire, always raise the alarm. Remember, the process is sound the fire alarm. This will usually automatically trigger a call to the fire service. If not, dial 999 or your internal emergency number. Commence evacuation and close all doors and windows if it is safe to do so. Never use lifts unless you have been told they form part of the evacuation strategy and it is safe to do so. In the early stages, small fires may be extinguished safely with a fire extinguisher, but you do need to know what you are doing and which type of extinguisher to use on the fire. Therefore, only staff who have been trained in their use should attempt to use an extinguisher on a fire.